Hi everyone, this is Vivek Kulkarni with usmle RX, and in this lecture we'll be talking about the kidneys. The anatomy of the renal system is relatively straightforward, but a lot of students find the physiology to be pretty complex. You'll probably see a number of questions on your exam that relate to renal physiology, either directly or by talking about diuretics, and it will take some time and practice to get good at them. On the other hand, most students find the renal pathology to be pretty straightforward and more dependent on memorization than understanding. We'll be going through the renal section of the book page by page. We'll explain some of the harder concepts and use images to drive things home. On the other hand, some of the information basically just needs to be memorized, and we don't do much more than mention those. Along the way, we'll use questions and mini cases to test understanding, and hopefully by the end you'll have a better sense for the important topics in renal and how to apply them on your exam. Let's start with kidney anatomy. As we said before, there isn't too much to know in terms of renal anatomy, but it's important to have a good macroscopic and microscopic understanding of how the kidney works. Let's start with the big picture. The kidneys are retroperitoneal, located at the level of T12 to L3 on the left and slightly lower on the right due to the liver. They are near the costovertebral angles on physical exam. They receive blood from the renal arteries branching off the abdominal aorta, which can be seen here, and they drain venous blood through the renal veins to the inferior vena cava. One important point about the renal veins is that the left renal vein is longer than the right, and it also receives blood from the left gonad. On cross-section, the kidney is split into cortex, medulla, and collecting system. Each of these areas has a separate function, which we'll talk about later. Now let's move on to microscopic kidney anatomy. This is where things get interesting. The structure of the nephron is directly related to its function, and you need to understand one to understand the other. Each nephron has a glomerulus that allows plasma to be filtered into a system of tubules. The afferent arteriole brings blood into the nephron, and the efferent arteriole brings blood out of the nephron. Remember, A before E. Plasma gets filtered into Bowman's space as ultrafiltrate, and from there it goes through a network of tubules. First, the proximal convoluted tubule, then the loop of Henle, then the distal convoluted tubule, and finally the collecting duct. Last, all the collecting ducts pool together their urine into the papillae, or medullary pyramids, which drain into the renal pelvis and ultimately into the ureter. The ureters are retroperitoneal and thus pass underneath the uterine artery or vas deferens on each side in their course to the bladder. One way to remember this is that the water goes under the bridge. This plays an important role in the surgery of this area, so this fact tends to be high yield on exams.